Welcome back for another deep dive. You've given us quite the challenge today. We're going to take a look at 10 diseases that have really kind of shaped human history and continue to impact lives around the world. We've got the familiar ones, like the flu, and then some of the more complex ones like Alzheimer's. Our goal today, though, is to, really extract the insightful nuggets from this research.
Yeah, it's a fascinating mix, and it shows just how vulnerable we are as humans to so many different types of threats, from those tiny little viruses all the way up to, some of the really intricate breakdowns in our systems. I mean, the diversity is just remarkable.
It really is. So for everyone listening, we're talking about influenza, COVID-19, diabetes, malaria, tuberculosis, and HIV/AIDS, hypertension, cancer, Alzheimer's disease, and hepatitis B. So are you ready to arm yourself with some really fascinating facts about these diseases? Maybe even shift your perspective a little bit on some of them.
I'm ready. Let's dive in.
Okay, so let's start with the one that I think we're all familiar with. The misery that we know all too well. The flu. We've all been there, right? Waking up and just feeling like we got hit by a truck. But here's something that I think might surprise some people. A single flu virus particle. It's tiny. About 1/10,000th the width of a human hair. I mean, can you imagine something that small?
It's wild, isn't it? And to think that something that small can hijack our cells and just cause, widespread chaos. It's just amazing to think about. It really speaks to the power of these microscopic invaders, and how efficient they are. I mean, did you know that one infected person can spread the flu to up to 10 others?
Oh, wow.
In just the first week of illness.
No, I didn't know that.
And you think about like touching a doorknob, right?
Oh, yeah.
Those viral particles, they can survive on surfaces like doorknobs for up to 2 days.
Ugh. That's both fascinating and terrifying. No wonder it seems like everyone gets it every year. Well, speaking of viruses that spread like wildfire, let's talk about the one that really shook things up. COVID-19. I mean, not just the immediate impact, right? But these lingering effects that we now call long COVID, the fatigue, the brain fog. It's a reminder that even when you get over that initial infection, the battle's not always over.
It's true. It's so true. And it really shows you the complexity of how our bodies respond to these invaders. The pandemic really highlighted the power of scientific innovation too. I mean, think about the development of mRNA vaccines.
Yeah.
Right? Like, it's amazing. We can use essentially a snippet of genetic code to train our immune systems to fight off a specific virus. I mean,
that sounds like science fiction.
I know.
But it's real.
It is.
And it works. Well, speaking of viruses that target our defenses, HIV/AIDS, for a long time, that diagnosis it felt like a death sentence, right? But thankfully, it's not the case anymore. Antiretroviral therapy has really been a game changer.
Yeah, for sure. I mean, it's really transformed it into, a manageable condition for a lot of people. It's probably one of the best examples we have, really, of how medical advances can completely change the trajectory of a disease. But, that leads to another question, right?
What's that?
What are the biggest barriers to access to these life-saving treatments, especially in the parts of the world that have been hit the hardest by HIV? That's what we need to be looking at.
That's a really important point. We have the tools, but not everybody can access them. Now, I kind of want to travel back in time for a minute. Let's talk about malaria and tuberculosis, these ancient adversaries that have plagued humanity for centuries.
Yeah. They're diseases that are really intertwined with poverty, inequality, the challenges that so many countries face with their public health infrastructure. Malaria, for example. Malaria thrives in tropical and subtropical regions where mosquito control is just incredibly difficult. Did you know that even today, a person dies from malaria every minute? It's crazy.
Wow, that's heartbreaking. It's easy to forget that a mosquito bite can be so deadly. And then there's TB, right? It spreads through the air. So it's a constant threat, especially in crowded environments. I think I read somewhere that 1/3 of the world's population is infected with the bacteria that causes TB. Most don't actually develop active disease, but it's like a ticking time bomb for some.
And what makes TB particularly challenging is the treatment. It takes, 6 to 9 months of antibiotics to fully clear that infection. That kind of commitment can be really difficult for a lot of people, especially in places with limited resources or inconsistent access to healthcare. It's tough.
Yeah. It's a good reminder that treatment isn't just about the medication. It's about the whole picture, a person's entire life, the support systems they have or don't have in place. Okay, switching gears now to something a little bit different, something that I think a lot of people are dealing with these days. Diabetes. We often hear that analogy, you know. Insulin is a key that unlocks our cells for sugar to enter. But did you know there are different types of insulin? Rapid acting, long acting.
It's a lot more complex than just a simple key, isn't it?
It is.
Yeah. And type 2 diabetes, it's not even really about a rusty key, which is what we sometimes hear. It's about insulin resistance, where your cells become less responsive to insulin signals. It makes it a lot trickier to manage. It's like the block is getting harder and harder to turn no matter how much you're jiggling that key.
That's a really great way to visualize it. I like that. Okay, well, speaking of things that we need to keep in check, let's talk about hypertension or high blood pressure. It's called the silent killer for a reason, right? You often don't even know you have it until something serious happens.
That's right. It's a silent epidemic, really. They estimate that about 1 in 3 adults in the U.S. has high blood pressure, and many of them don't even know it. It really is like a ticking time bomb because it's putting constant strain on your heart and your blood vessels, and that increases your risk for all sorts of serious problems like heart attacks or strokes.
It's crazy how easy it is to underestimate the impact of something that you can't even feel. Okay, let's move on to cancer. I think that's a word that evokes a lot of fear and uncertainty, right?
For sure.
And it's not even just one disease. I mean, there's over 200 different diseases.
Yeah.
All under that same umbrella, each with its own complexities.
Yeah, and what's fascinating about cancer is that it's essentially our own cells rebelling. Like something in the genetic code goes wrong, and then all of a sudden you have these rogue cells, and they start multiplying like crazy. They completely ignore all the normal rules of growth and division.
So it's like a cellular mutiny.
That's a good way to put it, I think, yeah. And it can happen anywhere in the body, which is, one of the things that makes it so scary, I guess.
Well, that's why we always hear early detection is key.
Oh, absolutely. The earlier you can catch cancer, the better your chances of successful treatment. And there's no one-size-fits-all approach, But we've made so many strides in treatment, like surgery, radiation, and even some of these newer approaches like immunotherapy. It's pretty amazing.
Well, okay, so from a cellular rebellion to a thief of memories, let's talk about Alzheimer's disease. It's this neurodegenerative disease that essentially steals away our most precious possession, our minds. And it's a growing concern as our population ages.
For sure. They estimate over 6 million Americans are living with Alzheimer's right now. And that number is only going to increase in the coming decades. I mean, think about it. It's more than double. And that's just in the U.S. It's a huge reminder of the challenges of an aging population and how desperately we need to find ways to prevent and treat this disease.
It's a scary thought. Losing those memories, the things that make us who we are. Okay, well, let's end on a note of hope here. Let's talk about hepatitis B. It's a serious liver infection, but thankfully, it's one that we can completely prevent through vaccination.
Yeah, that's a true testament to the power of vaccines and public health initiatives. I mean, the hepatitis B vaccine is incredibly effective, offers lifelong protection in most cases. It's a simple shot that can literally save your life.
Well, it's a great example of how we can use scientific advancements to protect ourselves from these microscopic threats. We've covered a lot of ground today, but we've really only just scratched the surface.
We have. There's so much more to explore. Each one of these diseases has such a rich history and such a complex web of factors influencing its impact. Maybe next time we could even look at how these diseases have shaped human history and how our understanding of them has evolved. I think that'd be really interesting.
I love that idea. We'll have to pick up there on the next part of our deep dive.
Yeah.
Join us then as we continue to explore this fascinating topic and all of the lessons we've learned along the way.
It really is amazing to think about how some of these diseases have been with us for like millennia.
Mm-hmm.
They've shaped societies and really kind of influenced the course of human history.
It makes you realize that we're not just fighting these diseases now. We're carrying on this battle that's been waged for generations. It really adds a whole other level of depth to understanding them. So where do we even begin this journey back in time?
Well, let's revisit the flu, right? I mean, it seems so commonplace now, but imagine a time when we didn't even know it was a virus.
Yeah. Before microscopes, before virology, I mean, people must have come up with some pretty interesting theories about what caused it.
Oh, they did. Some thought it was bad air. Others thought it was an imbalance of, like bodily humors. Crazy stuff, right?
Yeah.
It wasn't until the early 1900s that we finally figured it out, identified the influenza virus as the actual culprit.
So that was a huge turning point, huh?
Huge. Yeah, absolutely. That paved the way for the development of the flu vaccine in the 1940s.
It's fascinating to think about how that whole concept of vaccination, like how it's evolved over time.
Oh, for sure. It's a story that goes way back, centuries, long before modern medicine as we know it.
Right.
One of the earliest examples is variolation. That was a practice that was used to try to prevent smallpox. Can you believe this? They would actually take material from a smallpox sore.
Ew!
I know. And introduce it into a healthy person's body, hoping to trigger a milder infection and then hoping that that would provide immunity.
Sounds pretty risky.
Oh, it was. Very risky. But it just shows you, human ingenuity, right?
Yeah.
And how desperate we were to find ways to combat these deadly diseases. Then, in the late 1700s, this guy, Edward Jenner, he made a really groundbreaking observation. He noticed that milkmaids who got cowpox, which is a milder disease related to smallpox, they seemed to be immune to smallpox.
Oh, wow.
Yeah. And that led to the development of the world's first true vaccine, the smallpox vaccine.
Well, so the idea of using a weaker or a related virus to protect against a more dangerous one, that's been around for a while, huh?
It has, yep. And it's been applied to so many vaccines: polio, measles, mumps, rubella, the list goes on and on. Vaccines have really changed everything. Public health, saving countless lives. It's hard to overstate their importance.
It's remarkable to think that a simple observation about milkmaids could lead to such a monumental shift. Okay, so let's talk about another disease that has plagued humanity for a really long time. Malaria.
Malaria. Oh, yeah, that's an ancient one for sure. So ancient that we've actually found evidence of it in Egyptian mummies. Yeah. Dating back over 3,000 years. And for centuries, they actually thought it was caused by bad air. Malaria in Italian.
Yeah.
Emanating from, like, swamps and marshes. That's where the name comes from.
So they blamed the environment, not realizing it was a parasite spread by mosquitoes. It seems almost unbelievable now.
Right. I know. It really shows you how far we've come in our understanding of disease. It wasn't until the late 1800s, that scientists finally figured it out, identified the malaria parasite and how it was transmitted through mosquitoes.
And that was a game changer for treatment and prevention.
Oh, absolutely. Yeah,
Yeah.
big time. Led to the development of anti-malarial drugs and mosquito control methods.
And yet, even today, it's still such a huge problem, especially in certain parts of the world. I guess it just highlights the complexity of disease control, right?
Totally. You've got poverty, you've got access to healthcare, you've got environmental conditions, public health infrastructure. It all plays a role. Speaking of persistent threats, let's talk about TB, shall we?
Tuberculosis, another one of those ancient foes.
Did you know there's evidence of TB in Egyptian mummies going all the way back to 9,000 BC?
No way.
That's over 11,000 years ago.
11,000 years. It's hard to even wrap your head around that.
I know.
Right.
And back then, before antibiotics, it was just devastating. People called it consumption because it just consumed people from the inside out.
It's a pretty chilling reminder of how vulnerable we were to all these diseases before modern medicine.
Right. It wasn't until the mid-20th century that we discovered the first effective antibiotics for TB, streptomycin and isoniazid.
And that revolutionized TB treatment.
Absolutely. It made it possible to cure a disease that had, basically been a death sentence. It's amazing.
Yeah, a true testament to the power of science and human resilience. Let's shift gears a little bit now, though. Let's fast forward to the 20th century and talk about a disease that emerged with terrifying speed: HIV/AIDS. It just seemed to come out of nowhere in the early 1980s, and it spread so quickly around the world.
And there was so much fear
Yeah.
and misunderstanding.
I remember those early days. Nobody knew what caused it, or how it spread, or how to even treat it. And there was so much stigma, which made it even harder to address.
It was a really dark time, a lot of suffering and loss. But amidst all the, fear and despair, scientists, researchers, they worked so hard trying to understand this virus, how it attacked the immune system. And within a decade, they developed the first antiretroviral drugs for HIV.
Which marked a real turning point.
A huge turning point.
Yeah, in the fight against the disease.
And it shows you the importance of research, right? And investing in global health. We've come so far in our understanding of these diseases, but there's still so much more to learn and so many challenges to overcome. Maybe we could talk about how social and economic factors have influenced the spread and impact of these diseases throughout history.
Absolutely. It's such a crucial part of understanding the big picture.
Right.
The history of disease. It's not just about microbes and medicine. It's about poverty. It's about inequality. It's about access to healthcare. It's about all these complex social determinants that really, really shape health outcomes.
You got it. The context in which these diseases emerge.
Yeah.
And how they spread. I mean, that can make such a huge difference on their trajectory and on people's lives. It's really important to remember that.
So we've explored, the biology, the history of these 10 diseases that have such a huge impact. But it's not just about the germs themselves, right? I mean, we've been kind of hinting at this. The social and economic landscape really plays a big role in how these diseases take hold and the damage that they do.
Oh, absolutely. It's huge. Think about it this way. Imagine like a tiny seed of disease, and then picture the ground that it lands on, like fertile ground, poverty, lack of access to healthcare, limited education. That seed is gonna grow and spread like crazy in those conditions, way more than it would in a different environment.
So it's like this perfect storm. You have this biological vulnerability, and then you add in the social and economic vulnerability, and boom, suddenly you've got an outbreak or a chronic condition that becomes so much harder to manage.
Exactly. I mean, look at malaria, for example. A disease that is so deeply entrenched in poverty. You've got limited access to things like mosquito nets, inadequate housing. People can't even afford basic preventative measures. And that creates a breeding ground, not just for the mosquitoes, but for the disease itself.
And it's like this vicious cycle too, right?
That's right.
Someone gets sick with malaria, they can't work, they lose income, and then that pushes them even further into poverty, which makes them even more vulnerable.
Exactly. And we see that same pattern with other diseases. Tuberculosis, for instance, thrives in crowded places, poorly ventilated environments, often linked to poverty.
Yeah.
Inadequate housing. And the treatment for TB, like we talked about earlier, it's a long process, months of medication. It's hard to stick to that when you're just struggling to survive. To put food on the table.
It's a good point. A good reminder that healthcare isn't just about, doctors and hospitals. It's about that whole social safety net. It's about economic opportunity. It's about making sure that people have those fundamental resources that they need to actually be healthy.
100%. And that brings us to those lifestyle diseases, things like diabetes, hypertension, even some forms of cancer. They're often linked to things like diet, exercise, how we manage stress. But those behaviors, they aren't always just a personal choice.
That's so true. It's easy to say, eat healthy, exercise more. But what if you live in a place where it's really hard to find fresh fruits and vegetables? What if you're working 2 jobs and you don't have the time or energy to cook healthy meals? Or a safe place to even exercise?
Exactly. Our environment has a huge impact on the choices that we make. And those choices, they directly affect our health. I mean, that's what we're talking about when we talk about the social determinants of health. They play such a big role, but it's something that's often overlooked.
So how do we even begin to break this cycle? It feels so overwhelming sometimes, this intersection of disease and social inequity.
It is complex, but there are things we can do. Investing in public health infrastructure is key. Making sure people have access to clean water and sanitation, affordable healthcare, addressing poverty, promoting education, creating environments that make it easier for people to make healthy choices. It's about empowerment.
So it sounds like it's going to take a pretty multifaceted approach, huh? I mean, collaboration between governments, healthcare providers, communities, and individuals.
Definitely, yeah. It's not enough to just treat the disease. We have to address those underlying issues, the social and economic conditions that allow them to thrive in the first place.
So we've covered a lot in this deep dive. Viruses, bacteria, chronic conditions, even those diseases that target our minds. But beyond all the facts and figures, what's the one thing that you really want our listeners to take away from this conversation?
I want people to understand that it's all connected. Disease isn't just this isolated biological thing. It's a reflection of our society, our economic realities, our values, our priorities. And when we understand those connections, that's when we can start to address the complexities of disease and create a world where everybody has a chance to be healthy.
Well, that's a really powerful message, a good reminder that we're all in this together and that the solutions, just like our health, are interconnected too. So to everyone listening, we encourage you to keep exploring. What sparked your curiosity today? Which disease resonated with you the most? Dive deeper, learn more. Knowledge is power. Thanks for joining us for another deep dive, and we'll see you next time.